Hi everyone, I'm Bunchol Ryogu, a medical director and a chief clinical officer of Classes company. Today we will have a training course for the ULFIT users, which is useful for your practice to reduce a body contour in a more preferable shape and also better tightening for all the contours. Today we will start with what is ULFIT for the introduction and the ULFIT advantages for our practice and the clinical effects for the patients and some treatment tips and combination treatment options and frequently asked questions and answers and some of the clinical photo discussion. ULFIT is using the HIFU technology to decrease the fat volume, the unwanted fat volume. It uses 2 MHz in frequencies, and the energy is delivered to the subcutaneous fat tissues with 6 mm and 9 mm penetration depths. We will give the energy converted to the heat in the fat tissues. Fat tissue is composed with a larger size of the adipose cells and the storage of the fat and some fibrous tissues and the connective tissues inside. And also, it offers quite faster body contouring compared to the others using the different kind of treat mode, the G mode and the P mode. I will explain what is differences in between the treatment later. And we have 3 different depths in a 6 mm and 9 mm, and for some regions, we offer 13 mm depths for much more bulky fat regions. We call this kind of changes as a term of the macro-focused circular ultrasound, the MFCU. It is using the movement of the transducers making the circular type of the coagulation zones with the large affected areas. And the changes start with the temperature erosion to the 65 degrees Celsius level, which is provoking the denaturation of the collagens and other kind of fibrous tissues, and also they're giving the not so convenient kind of environment to the adipose cells for its metabolism. So usually the higher temperatures we can induce the necrosis and some of the irreversible changes in the adipose tissues, but still we can induce with a less painful 65 degrees Celsius, we will start our changes in the fat tissues. This one is a little bit different with the other high-focused ultrasound with a micro-focused, with a much more precise kind of a coagulation zone. So it is using much more over and the vertical columns with a larger area. So it is called macro-focused ultrasound. When it is used with a much more stacked ways and the overlapped ways, we can induce finally some of the bulk heating lesions. So when you deliver any kind of heat lesions from the surface to the inside, we will have a much more energy for the surfaces, but less energy, loss of energy will go much higher and larger when we are going to penetrate the deep. But this kind of a macro-focused ultrasound delivers energy inside the focused area, but more large area. So when you're giving the bulk energy from outside to inside, but sparing all the epidermis and all the important structure for the outer looking, it is quite good option to give the bulk energy. I think this one is one very, very important benefit compared to the other kind of bulk heating devices to the deep areas. And the principle of the HIFU treatment is like this. When we have a stubborn fat cells and cellulites, it is quite deeper seated and it is quite difficult to eliminate. And the HIFU energy is delivered into the tissues without damage to the superficial layers. It is targeting almost the whole fat area. So the targeted cells, we will have a natural cell death. It is a little bit slower than the other kind of necrosis-inducing treatment, but it is very constant and the continuously happening. And then finally we have a dead fat cell debris and other kind of the fat components should be metabolized and they should be eliminated from our immune system. We have two modes of the treatment. One is G mode and one is P mode. When G mode is the spot by spot and move by move treatment, so you can just like a stamping motion, and the transducer will spin automatically for each shot. So it will give a very constant depth and a constant energy delivery. So if you are treating very narrow areas with a much more precise depth focusing, or if you are treating very, very gentle and delicate area, this is more suitable. But the P mode is offering much faster the treatment. It is upon the hand movement speed. So if you can just rubbing like massages, it will go continuously giving the energy inside in more stacked ways. So the gradual energy decreases will make a whole area treatment. So this one is quite comfortable for treatment for larger area. So usually we estimate the differences in between the treatment time around the 30% faster in the P mode. And also if you think that this one is the vertically looking from the sky view, you can see that the coagulation zone is a little bit different in the size and the shape. So if you stack all around, you can see that this kind of differences can be smaller because it is stacked and mixed all over. But this one is quite higher energies inducing the coagulation zone, but still we have a much more larger area surrounding this kind of area with the denaturation and other kind of the tissue changes before the coagulation can happen in it. And this one is a fat melting test with the higher energies. You can see that it immediately changes the fat area with the melting kind of the changes, but usually not going this kind of a tissue change degrees. Still we can have the effectiveness with the metabolic changes of the fat cells. This was one interesting phenomenon, the skin reaction immediately after the treatment. We can see that the redness and the tenderness, but also we can see that the reduction of the circumference right after the treatment. I think it is upon some of the shrinkage is inside with different kind of inflammatory changes, the initiation, but usually it is recovered by the swelling immediately after this kind of phenomena. But it is still useful to check the immediate checkpoint or the endpoint for the treatment. But this one is a little bit different with the individual differences. So usually we are recommending the initial treatment should be in the total energy or the total charge of our guidelines. This one is one good example of the published articles with the high flow or high intensity focused research on the macro type of the coagulation for the subdermal tissues. You can see that the contouring changes in some of the volume changes also with the contouring changes. This one is a line change and the bulk change at the same time. So you can see that if you can just make 4 dimensions of the fat areas, you can see that this one, and lactus muscle in the lateral pages, you can see that the different kind of the fibrous tissues area. So you can see it's much more smoother and the continuous kind of the contours, much more smoother surfaces. And usually the overshape of the treatment design is offered by our guideline and our template for the checking the rules, but it's quite easy. You can just keep the number of the shots for each area, so it's quite useful. Of course, you can just add some of the treatment when the tissue is so bulky or the patient BMI is too high. Maybe you can just add one of or you can just giving these kind of shots for multiple doses. It's upon the how much of the energy should be necessary for certain regions. And this one is for the safety. You can see that the nerve distribution on the body usually not aware for usually not noticed when we are treating the superficial regions, but sometimes we have a variation that is localized, a little bit superficial compared to the other individuals. So usually the most uncomfortable part is posterior superior iliac spine and the anterior superior iliac spine. So we can see that this kind of the sciatic nerve branches, sometimes you can see that a very tingly kind of sensation when you're treating. Just to spare that area and move on to the next area. That's enough. And for more safety, we are just recommending that if the patient is so skinny or if the patient is a little bit nervous about the kind of symptoms, you can just spare some of that, because the armpit, usually this folded area and this folded area is much more focused in the large bulk of the fat tissue. So you can just spare this area, and you can just add superficial the depth of the treatment for this region only. So for 9 millimeter or the 13 millimeter skin treatment, depth treatment, you can treat just this area with much more safety. Also for the sciatic nerve, it is upon how the area is bulky or not, but you can see this kind of area is quite comparably treatment with safety. But still, if the patient is so skinny and if the patient has a very, very uneven kind of contour in the fracture area, you need to be a little bit careful. So we are offering this kind of a matching according to the pinch test result with a 1.2 centimeter or more with the 6 millimeter cartridges, and 1.8 centimeter or more, the 9 millimeter cartridges can be offered. And with the pinch test more than 2.6 millimeters, 6 centimeters, we can offer the 13 millimeter cartridge. But it is some of the reference, the accordingly matched kind of suggestions. So if your patient has a thinner skin and if your patient has a large, the bulky area with a much more tightened the dermis, it can be a little bit adjusted. And if the patient have cellulite on the abdominal size, sometimes it can be used for the body contouring and also with the cellulite improvement with a different kind of energy. So you can just go on with that. Usually the cellulite needs a little bit more energies to be destructed compared to the adipose tissues. So sometimes we are combining other devices like a Sizer or either the high-focused ultrasound, even micro-focused ultrasound in a much more stacked ways. But still we can just offer this kind of combination options. And this one is a grid options for the 500 and the 400 shots. It is upon how large areas we are treating. And you can see that the differences between the total area shots is around the 25% to 30% of the differences. But still we can just stack or the overlap the energy levels. So it is not important, but it is good guideline for that. And it is good for the design marking. Usually the pinching test and the one handful at the grip of the region is covered only the medial to the leg tooth muscles at the margin, or in this kind of superior to the anterior superior iliac spines and the lower quadrant. This kind of the whole quadrant, if the patient is a little bit skinny, then you can just take pics with these 4 lesions at the treatment. Or if the patient has a back tummies, you can just go on. And if your patient is just complaining the longitudinal lines and other kind of back lesions, still we can just overlap things. And for the lower body parts and for lower extremities, you can divide a little more detailed ways like this. In the picture, you can see that one. Especially if you want to treat and then the upper back and the armpit together, some of the lesions will be overlapped, but it is not the important so that way. So you can just go much more perfectly to use this kind of guidelines. And this one is good positioning and some of the measurement and design. You can see in a much more relaxed way in a supine position or the on the belly or whatever. The region should be to be treated should be relaxed without any kind of contraction of the muscles. So you can just move with the horizontal movement, like the trembling or the tremoring like this, and you can see that the fluctuation and the rambling kind of portions for that. So you can just pinch with the hand promotion, or you can just pinch test for the superficial areas, and you can just fix one area with a guide, and then you can just start with this. And usually, if the patient is a little bit skinnier and the lesion is just too close to the bone, or the patient is too nervous for the pain or too sensitive for the pain, maybe you can just pinch up the lesion like this. It is finger, but you can just use this kind of a motion, and then you can give the energy a little more the relaxed way, so you can just give the treatment much more safer and comfortable ways. And these ones are another tips and other tips that we need in a pain control. If the patient is too picky and complaining too much of the pain during the treatment compared to the others, the first step is applying the more ultrasound gel in a cold kind of temperatures. It will relieve the pain and it will relieve the pricky sensation together. But it is usually, if the patient is too sharp and too superficial, this one is quite good working. And the second step tip is to increase your hand speed moving, hand pace moving speed. Because if you are moving speed in a circular motion much more faster, it decreases the saturation or the slope for the increase of the temperature a little more downward, but it will give the less pain. Eventually, it will have enough kind of energy into the tissues, but it will take a little more time, but it will decrease the pain. And the third step is quite similar. If you can just adjust the treatment energy level a little bit lower than the usual, you can give the energy a little bit slower, but still we have a positive relation to the accumulated total energy volumes. And also intensity is quite important for the contouring when you have a lot of cellular inside. But if the patient is quite loose kind of tissues, you don't need to go faster too much. So it is quite flexible option to decrease the pain control. And for better clinical effect, definitely we need more energy. So if the patient is not satisfied or not happy with the result, maybe we can just increase the more energies. In that case, it's just painkillers and the very ordinary pain control is quite useful. And if the patient has very sensitive skin, which is quite well irritated and well getting red and some of the other kind of superficial kind of problems, maybe superficial, the local anesthesia can be useful, but usually the deeper seated kind of a dull pain is not covered with this. So in that case is to increase the treatment result and also with the pain control, tumescent injection can be a little bit more helpful. And the maximum energy level is reaching up to the 3.0 joules, but usually it is quite flexible to use so upon the comfortableness. And this one is another clinical evidence. I will just introduce much more briefly. you can see that the histological changes in the dermis, which by columnization, is quite different with the other high-focus ultrasound with the bowl shape of the coagulation zone. And you can see that this one is reaching to the destroyed fat tissues. And this one is quite experimental. Maybe you can target the muscle, you can maybe target the blood vessels, but it's not target for our today's session. And this one is they're giving that with or without the tumescent solution injections. The result is that if you are giving the tumescent solution injection with a much more hydrated tissue condition, you will have a large coagulation zone. So this kind of a thermal injury zone is has a positive relation to how much of the tissue hydration can be given. So if you are hydrating with the tumescent solution, you will have a larger TIG formation. So if your patient has large areas with too sensitive for the pain, maybe you can just add this kind of solution with a tumescent solution injection, and the ULFIT treatment will give the satisfaction level much more higher. And also there are a lot of combination options. For bulky fat removal, the Clato alpha, they're giving the cryolipolysis is a good combination option. Usually we recommend the treatment with ULFIT should be followed after the alpha treatment, which is starting to have the apoptosis or the necrosis of fat tissues, because in that area, in that kind of phases, we have a lot of inflammation, cells inflammation, infiltration. So after that, in a remodeling phases, we can give them much more profitable ways with the ULFIT treatment. But sometimes, if you want to go for the very smaller regions and the lower energies, maybe you can give these treatments with a sequential or consequent kind of a treatment plan, but still we need a little more gap in between. Also, you can go for the ULFIT with the other kind of the physical massage or the physical treatment, like a lymphatic massage or other the endomologies or other kind of blood circulation enhancement. It is well known that this kind of metabolic changes can be enforced with this kind of passive kind of regulation, but still we have a lot of differences in between these kind of devices. So the main concept of the treatment should be given with the ULFIT, and then other kind of devices can be given as the additive or the supportive kind of option. For the bulky fat removal, what about the lipolysis or liposuction? Manual liposuction, assisted or mechanical liposuction can be given. And if the liposuction can be given and if the tissue remodeling is happening, this kind of ULFIT for the uneven kind of condition, not every liposuction gives the smooth fit. So if you can give the ULFIT for the kind of fitting for all the after the lipolysis condition or after liposuction condition, I think it's quite good option. Maybe you can give the superficial liposuction with other kind of energy delivery devices, but large area with a much more the uneven kind of controlling ULFIT is quite good option for much more smoother lines. Okay, let's check with the ULFIT clinical photo reviews with the clinical cases reviews. You can see this kind of lower abdominal flank treatment. You can see that the dimples before the treatment indicating the contour differences, uneven kind of contour. And then you can go for after the treatment much more smoother and slender kind of the abdominal lines. In between, you can see that the volume changes, the prominent changes. And you can also see that the lingerie lines and the folded lines and folded augmentation decreased after the treatment. And also along the umbilicus and along the anterior superior iliac spines, you can see that the differences in the lower abdomens. And if you look at this kind of the lines for the abdomen, so the rectus muscle and the rectus muscle lateral to the rectus muscle. You can see that the differences in the coronary section views. And this one is for the armpit treatment. You can see that the upper arm, the circumference is quite different before and after the treatment. And this one is the last slide of the show. So to summarize, the ULFIT is quite good option for giving the tightening or the smoother lines after any kind of a lipolysis treatment. Also, it can give a much more large area with a speeder waist with giving the heat inside. So I think this one is a good option to replace other kind of classical the heat-giving energy devices to the deeper areas, but all of those kind of devices usually can give the energies mostly on the superficial waist, not large in the deeper waist. So I hope that these kind of techniques and the protocols and the clinical designs are the kind of this training guide will help you for better your practice. Thank you. Okay, we have frequently asked questions. I will give the answers for that. And I will introduce the collected questions first and then answer the questions. The first question is about the intervals and the treatment session numbers. The first question is, how many times will give the real effectiveness? Usually, we recommend to at least 3 or 4 times to only with the ULFIT, but it depends which kind of combination option can be given. And also, with a higher BMIs in the larger bulk areas, we'll see much more prominent changes much more easily. But if you have a very small lesions and if the patient is very young and skinny and the result volume is not so large from the expectation, maybe we can see the result a little more not so prominent. So if you can measure the result in a much more objective ways, like circumference changes or other kind of photographies, it will help the viewing the effectiveness. Second question is, how frequently can we treat? It depends, because usually for the metabolic changes and other kind of fat elimination theories, we recommend the 6 weeks intervals or at least the 4 weeks intervals to have tissue remodeling changes. But if you are using the smaller energies, or if your patient is other kind of the schedules is quite tight, if the patient is giving the photography shots with a professional model, maybe she can add not so prominent kind of downtime with a shorter interval kind of treatment. It can be allowed. So if you are giving the lower fluences and the lower energies, maybe you can give the treatment like a division of the treatment in a more divided way in the shorter intervals. It is available. But basically the 4 weeks or 6 week interval is a standard kind of intervals. Next 3 questions is about the combination options. First question is which kind of methods can be combined with the ULFIT? Basically all of them. Any kind of endomologies, lipolytics, or manual massages, or liposuction, ultrasonal guided, ultrasonal supported liposuction, quite intensive ways, and anything can be done. But if the patient has a lot of inflammation process from the other kind of treatment, maybe you need to give a time gap in between the treatment, because it will increase the side effective the properties, or it will give the more chance to the complications. So that's because of the safety, not for the effectiveness. Next question is, can we treat ULFIT with the ultrafilmer or other RF devices? And if it is possible, if it is available, which will be the protocol? I usually recommend you can treat, but different levels. If you are treating the superficial tightening, especially for some lesions, like if the patient lost too much of the weight in a very fast way, you will see drooling or the loosening of the skin, and also the not so even kind of contour in the deep tissues at the same time. Maybe you can go for the ultra focused, high intensity focused ultrasound for much more superficial way in the microcoagulation zone, and you can give the deeper side with the ULFIT. So if you want to give different kind of a treatment, maybe you can divide the different kind of energy levels or different kind of the treatment depths. So that's my recommendation. Next question is, if you have other kind of high focused ultrasound and the ULFIT together, can we treat for the patient, one patient at one session into 2 units? My answer is all the same. If you want to treat different kind of levels, different kind of targets, you can divide level by level or depth by depth or layer by layer treatment. You can go for the smash treatment with other high flow, or you can just give the looseness or the contour treatment along the smash. So you can just give all of them, but different kind of depths. And the next 2 questions are the patient selection. And the question is there any kind of differences in between the female and the male patients? Usually, I think this kind of differences is a little bit different individual by individual than female versus male. Because if the patient is young, if the patient is quite tight in the skin tightness, or if your patient is getting too much of the weight in a very fast way or lose the weight in a very fast way, maybe it can change, but maybe the property can be changed, the protocol should be changed. But I think that kind of difference is much more important than the differences in between the female and male. Next question is, what about the posterior neck hump in a middle-aged woman? Maybe you can try, But I think this kind of hump can be composed of the different kind of section. Maybe if you can just pinch the hump, if the patient is quite chubby and if the patient has a lot of larger BMI numbers, maybe the kind of hump is composed of the fat, you can just go to ULFIT. But if the patient has a very older ages with a little bit lax skin, so if the hump can be pinched like this is short, maybe the skin tightening can be first. So in the cases, you can go for the high flow and other kind of superficial oriented treatment. And next question is, which patient is best for the ULFIT treatment effectiveness? I think that the contouring and the tightness, the problem is overlapped for the one patient. I think is quite good. The combination, the ULFIT indication for the treatment. Is there any kind of contraindication for the patient? I think there is not so specified contraindications. I think the common contraindication for any kind of surgical treatment, like the blood coagulation disorders or other kind of underlying diseases or other kind of the allergic kind of symptoms, allergic disease like cholinergic urticaria or the angioedema, should be excluded from the patient screening. But not the other kind of treatment, but not all the kind of skin conditions or other kind of treatment is not contraindication for the ULFIT treatment. Is there any limitation for the patient age for the treatment? I think no. Next 2 questions for the treatment purpose, how we can recognize the end point when we have the treatment for enough number of the shots. Usually we are giving the guideline for the certain regions with the 400 to 500 shots, so you can just give them, and then you will see immediate erythema and the wetness, little bit more swelling after some of the shrinkages. It's very, very standard kind of the reaction from the skin we can observe from most of the patients. But if the patient it has a very decrease of the sensory neural functions, maybe we cannot see the kind of reaction. But still, we recommend the kind of given number should be the standard or the guideline for the treatment. And the last question for the treatment part is, what about the post-care should be given to the ULFIT, and will the kind of post-care will affect the effectiveness of the treatment? I think the most important part is we tried our best to decrease the fat volume and also with the contour. So the general exercise, workout, and diet control should be given. Or if the patient is not supposed to do the things, maybe we can add other kind of medication to help them. And also, I think it is quite the same for any kind of energy delivery devices, but especially for this kind of metabolic changes. Any kind of pro-inflammatory condition is not good for good wound healing and the good tissue remodeling. So I think the other kind of lifestyles the patient can control by themselves, like smoking and heavy drinking and other kind of the inflammatory sequences, like other kind of systemic illnesses. I think that we should try to avoid them best, as best as we can. So I checked the skin thickness with the caliper. They measured around 1.6 to 1.8 millimeter, quite slow, quite thinner and slender patient we have. Still we have the guideline and the grid with the puncture holes like this. We can pinch with our grip here, and the next target thickness or the fat area is like this. So we can just spread out like this in this position, and then locate the grid like this, make some marks on the holes. Like this. Basically, you can see the 400 shots of the treatment area like this. We will start the treatment here. In the control panel, we have a P control mark here. With the indicated on, we are using the pain control mode with the P mode, and like this. And if it is turned off, we are treating the traditional G mode or stamp mode. So we will start with the G mode first, and then we will compare to this. We are applying both the treatment area and also with the tip of the transducer like this. And then so with the G mode, with the stacking, you can just keep the handpiece like this, with giving more shots in the intensive ways. So if you are treating very large or even small lesion, or like the questions, if you have a very small hump on the back or the very small areas, maybe this kind of stacked treatment can be much more beneficial. And with the P mode on, this kind of circular motion will give much more constant energy. How do you feel? Good. Okay. It's less pain. Sometimes the patient feel just the warmness, but the accumulated energy is almost the same for that. If the patient is feeling just uncomfortable, moving the shot like this in a faster motion will relieve the pain a little bit. Now we finish the half of the treatment. Now we are reaching the 75%. Okay, well done. Did very, very well. Okay, good. You will feel a little bit warm here, and but the redness and everything didn't happen too much. So I think it's a good endpoint, and we will go on to this race. We have the immediate actions, but we will just go there. Actually, most comfortable position for the armpit is like this, with the patient abdomen lie downward, and you can just pick surrounding the arm like this, and pushing upward, having lifted motion. But if the patient have a back pain, or if the patient has something uncomfortable with the position lying down like this, maybe you can just go for just a supine position, and your arms like this and your arms like this. It's just upon the patient comfort. Okay, with more than 3 millimeters, we can go for that. And this is an injection point for the tumescent anesthesia. 여기 있어요. 아니, 여기 있어요. 제가 들고 와서 까먹었어요. 오케이. 진짜. 펌프를 해주고. Oh no, don't see that. 버번할게요. So we are giving this area in a circular motion with a P mode. And if the circular motion is like this, with the inverted kind of triangular motion, sometimes your energy can be going to the ASIS with the periosteal surfaces sometimes. So usually we are giving these kind of large motions to focusing on this deeper area in the center of the whole treatment area. So this one is a good endpoint option. You can see that the redness, and if you touch inside, it's quite warm. And if you're deeply touching, you can feel a little more hot inside. So in these cases, usually we are not going for the 65 degrees Celsius for the full ranges, but with a little bit lower temperatures from the 55 or a little bit lower, we can see that the denaturation of the fibrous tissues and also with the metabolic changes of the adipose cells. Now we are starting to treat this area with the lower quadrant of the lower left quadrant of the abdomen here with a marked area. This one with a larger the amount of the fat, and we gave the tumescent solution here inside. So it is expected to have a larger the thermal injury zones or the coagulation zones. So they will give the little bit higher energy with this, with a little bit deeper penetration depths. How do you feel? Huh?
Nice.
Nice.
Nothing.
Nothing, okay. Because the tumescent solution was given to these depths, the patient feels very comfortable, but the endpoint will be given shortly. So please keep your eyes on the areas with checking how many shots we are giving to them. And this one, the 9mm spot, the tip, 9mm depth with a handpiece, and high fluence treatment, it will give the very, very large area effective. So keep your hands moving in a consequent motion and check the end point from the surfaces. Now I can feel the little bit warm sensation from the deep tissues starting, but it is a little bit slower than the non-tumescent treated area because firstly the hydrated volume is just larger than that. So we need more energies accumulated to increase the temperature. So it will give the deeper the penetration from the deep, and the continuously the heat sensation will prominent in the superficial area with the treatment is given. Because we make anesthesia from the deeper tissues, the endpoint is coming slower once again, and the changes that's seen in our eyes, it happens a little bit abruptly. So it will give you the sensation that you have a lot of the enough kind of erythema from the regions. So please continue to checking the kind of endpoints. Great, well done. Woo. We'll go on to the next. So we can see the endpoint here. It's a little bit swollen, but not making the contour abruption, and some of the redness can be detected. And usually the patient is starting to feel the pain at the here and the pain inside. That's beautiful endpoint here. And I will show you some of the stamping here. You can see the movement of the transducer here in the screen. So with one circular movement, you can move to the next place like this. It's very precise, and it is very suitable for the smaller lesion, but patient feel a little bit more sharp kind of a feeling for that. When you're treating this lesion for a long time, the frequently making mistake is treating the umbilicus, because this one is to be saved, because this one is, if it is damaged, the wound healing is quite slower, And sometimes if it is the mutilate from outside, the crust will last a little bit longer time. So please be careful not touching this region. Maybe you can just block this way, like this. We are having the treatment. We are giving the treatment for the love handle cord, the flank, the fatty areas. Usually we have a point for the ASIS here, so we excluded this area from the design, and we are lifting up from the lower part to decrease the pain and also securing the treatment plane. Usually the patient has a different kind of demand, whether to decrease the volume here or volume here or volume here, or most commonly here. So you can just design different kind of ways. So for the lateral side, you can see in this position, you can measure this area. With a 5-shot grid, you can just pick the spots along the line all the way to the lateral margin, like this. And for the inner area, like this, you can go like this, the 400 grid. And you can see that this fracture line, you can see that this one is a safety line with 10 centimeters. And can you spread the leg a little bit? Thank you. If you can just grab this one like this, you can see this one like an armpit. You can check this area like this and make a design. Like this. These 3 regions has a different kind of skin reaction. For example, this way is a little more tightened and thicker at the dermal thickness, and this one has a very sensitive and a lot of nerve endings. So usually I recommend to use the smaller energies and the faster motion here first. And this one can be given a little more aggressively from the first with the higher fluences. This one is just in between, but individual differences for this region, the sensitivity is quite different. So please check 1 or 2 shots first to check the patient responses, and then you can just adjust your parameter. We have a very good combination option of these 2 devices, giving the fat volume decrease and giving the fat tightening and the better contour. Usually we can use these devices at the same day, but I recommend to give the time gap in between at least the downtime, remarkable signs like erythema, swelling, and other kind of the parasitic kind of sensation. All these are gone, maybe you can just go for the second treatment. And if you are continuing the alternative sessions, maybe after the treatment is over with the wound healing processes, usually after 3 days, and moreover around the 2 weeks, it will go for the remodeling phases of all the wound healing process. So usually to check the fat decrease result and giving the plan or protocols according to the kind of changes, basically and conservatively, it is recommended to go for the 3 or 4 or 6 weeks of the intervals. But if you are going for the lower energies, if you are going for the gentle treatment sessions, and if the patient is requiring more faster kind of intervals, maybe you can decrease the energy, or you can just give the enough, at least enough time for making the recovery from the previous sessions. Thank you for joining us today's training sessions using ULFIT and the combination with the alpha. So I hope every patient of yours can be relieved from the unwanted fat and the deformed contours from your hand. Thank you.